Hello. Hello, everyone. We're just about to start. My name is Ekaterina. I'm asking you to just wait a minute for Roberta, my colleague from TranslaStars, to reconnect, and we'll start. Please use this time to introduce yourself. I see that a few people have, yeah.
Sorry about that, but technical issue on my side. I'm very, very, very sorry. Just the Wi-Fi failed me when I needed it so bad. Sorry about that. So you were saying, Ekaterina?
I was suggesting that our attendees introduce themselves while we were waiting for you. So I see that we have people from all over the world here, and it's exciting.
Yeah, that's great. I'll introduce you. So yeah, we can go this way. So I'm here today. Well, I'm Roberta, TranslaStars content manager, and I'm here today with Ekaterina Chashnikova, and I hope I'm pronouncing it right. Pharmacist, medical translator, and writer. So Ekaterina, how are you?
Oh, I'm great. Thank you. How are you?
A bit anxious because the Wi-Fi failed me, but I'm going to be fine. So actually, we're here today to talk about the essential role of pharmacology in medical translation. And before we start, so you can introduce yourself in the chat as Ekaterina suggested, but also please remember to drop your questions if you want to ask Ekaterina anything. And please remember that this interview will be recorded, so you can catch up on it later. So Ekaterina, are you ready?
Yeah.
Okay, so let's get started. My first question for you is, can you please tell us a bit about your background and how you got started in the field of medical translation and localization?
Yes, sure. I'm a pharmacist originally, and I've discovered translation on the fourth year of my studies as a pharmacist because I just wanted to earn some money, and I saw a short note on the advertising board in the university. Someone was looking for translators, and I called them, and that's how it started. And surprisingly, I enjoyed it very much because I've tried by then to work in a pharmacy, to promote some products in a pharmacy, also to work behind the counter as a pharmacist assistant, something like that. So, but translation really stole my heart back in, it was 2007. And I enrolled in a program of additional education. I finished my studies as a pharmacist, and in parallel, I was already studying linguistics and translation. It was a 2-year program, so it really started very quickly because I think half a year after I started translating, one medical translation agency got me on board as an editor. and I've worked in a translation agency for over 2 years as an editor and later project manager. It was a great experience. It gave me a wide understanding of the market, deep understanding of the clients and their needs. But I wanted to develop further as a linguist, so I went freelance, and I'm a freelancer since 2010. I've been creating and delivering webinars and courses for translators starting from 2015, I think. So now I'm also, an important part of my journey is that I'm also a medical writer. It's a quite recent development. I work in an agency, and I develop all kinds of promotional materials that I previously translated and localized as a translator. And it also gives me the opportunity to look at this whole process from a different perspective, to understand why these materials are developed the way they are, and some also nuances connected to target audience and purposes and key messages and so on. So briefly, that's my background, I think.
That's really impressive, because at some point you were studying pharmacology and then also studying translation. So that's really impressive. You got to, do these two things almost at once.
Well, it was my final year, and I had I didn't really have that much studies at the pharmaceutical school. So, but it was tough. Yeah.
Yeah, I can imagine. More in general, what challenges do translators and interpreters face when dealing with pharmaceutical or medical content, and how does the knowledge of pharmacology help overcome these challenges?
Oh, okay, let's turn to this one. Yeah, it's a really good question. From my students and my colleagues, I know a lot of people who are linguists and would love to translate medical texts, medical documents, because they just love medicine. And I think one of the main challenges is that there's so many information to digest and to translate medical texts. It might seem overwhelming. And especially if we talk about drug products and pharmaceutical translation, for example, prescribing information or some scientific articles, or maybe even articles about drug products for a wider audience, for lay audiences, they also may be challenging, because the translator has to know a lot of terms and concepts, understand different processes in human body, and how the drug works. So pharmacology is actually, it provides a kind of structure and basis to understand all this, because pharmacology is how drug products affect human body, how they work. And also pharmacology covers what happens to these molecules when they enter human body. And so when knowledge of pharmacology helps understand the whole picture and translate not the words, but the concepts and the meaning. And also, an important aspect of pharmaceutical translation and pharmaceutical texts is that many of them are regulated. For example, the core information about drug products is developed by a lot of people involved in the development and approval and registration process, whatever you call it. And later, this information is approved by regulatory authorities, and it can be found online. And it should really be the basis for translation, because documents that we translate, they are used in communication between pharmaceutical companies and doctors and patients, and these communications are also regulated. So it's important to know which parts of the text, for example, are I don't want to say word regulated, but which parts should be compliant with the prescribing information, with some approved classifications and names, registered proprietary and non-proprietary names. So I hope I didn't get you bored with this, but it's a really important aspect. And for linguists, it's really important to understand where to look for this. As a pharmacist, I've studied all these documents, and I know that there, for example, as a pharmacist, I know that there are official registers of drug products and official approved information, and I know where to look for it. And as a teacher, I can show it to my students. Like show them, guide them in this, I don't know, ocean of information, and so that they also, so that their translation will be more justified, and it will be not just correct, but also compliant, and it will make them, when a translator references an official, for example, when a translator can justify their translation and base their translation on some official document, it gives more weight to their justifications, and it makes them look more professional. So this is also important for a translator's career, to understand this regulatory and compliance aspects in relation to drug products. So I think that's about it. First, about going back to the challenges. First, there's a lot of information, and you need some basis and structure. And second, some of this information is regulated, and translations also should be compliant. And when translators, when a translator knows where to look, they can add more value to their translation.
Mm-hmm. So, do you think knowledge in pharmacology is useful both to beginner medical translator and experienced medical translator, or I don't know, is it suitable for everyone, or you would suggest it to one group or another?
I think it is suitable and useful both for beginners and experienced translators. I've also had doctors come to my classes and study pharmacology with me, and it was very useful for them to look at this discipline from a translator's point of view, and from the perspective of translating certain types of documents, not just memorizing drug products and their effects and classes and so on. For beginner translators, knowledge of pharmacology, general pharmacology, I think I'll just take a couple of minutes to explain that there is general pharmacology, which covers like general laws and principles of how drug products work, and how human body affects the molecules, the active substance, and the whole drug product. And there is also more specific pharmacology that describes different kinds of drug products, different classes, molecules, and so on. And for beginners, it's really important to understand the main concepts, the basic principles, and the general terminology. And for experienced translators, first of all, medical translation is a very wide area, and a person who is a medical translator might work with medical devices or software or just texts that maybe describe anatomy, physiology, and different diseases, but not specifically pharmaceuticals. So a deep understanding of pharmacology can be a great addition to their expertise and might help them gain an additional area of expertise for their CV, or maybe a pharmacology, by the way, is a great knowledge of pharmacology kind of opens you the door to clinical trials, because clinical trials are, most of them are about drug products. And in addition to understanding how the trials are conducted, you need to understand how the drug product works and why they are testing it this way or that way. And so it's kind of paramount for translators and interpreters who want to work in clinical trials. And I also I mentioned interpreters. Do you mind if I tell a few things that might be important?
Go ahead.
I don't know if we have interpreters in our audience today, so maybe if you work as a medical interpreter, you could drop a word in the chat. So show yourself.
Raise your hand.
Your hand, yeah. So personally, I've worked as a medical interpreter, and I've worked both at conferences and meetings, and also at doctor's appointments as an interpreter. And there are two aspects that two benefits of pharmacology for interpreters. First, when you work with doctors and patients, often situations arise when someone needs to adapt brand names to non-proprietary names. I also helped doctors find, when a doctor from another country comes as a consultant, highly experienced consultant, they want to prescribe some product, but they don't know the local market. And I know how to find the drug products that are available in local market. This issue also can arise during translation, when the client wants to adapt the text to a local market, and the translator needs to find which trade names are available in local market. So this is also where knowledge of pharmacology can be handy. And also another important aspect for interpreters is that pharmacology is, there's a tricky bit to pharmacology, and it's mathematical, because some parameters are calculated based on complex formulas, and there are some graphs and plots involved that show effects of drug products over time, blood levels over time, and so on. There are some interpreters here. Great. Nice to meet you. For example, in my pharmacology course, I explain all these plots and graphs that are used to understand and study pharmacology pharmacokinetic, pharmacodynamic properties, meaning the concentration and blood levels of drug substances, also to study how fast the drug substance is eliminated from the body, and also some diagrams show effects of drug products over time, both beneficial and harmful, potentially harmful effects. So for interpreter, it's a great skill to know how to read these plots and diagrams, because when they come up on a screen during a conference or a meeting, if an interpreter understands what this graph shows, they can kind of predict what the speaker will be talking about, and it makes interpreting easier. So that's, and I think it's an important point, so I wanted to mention it, not to get lost.
Yeah, that's a life-saving skill sometimes.
Yeah, the prediction is,
it's crucial.
Yeah, I agree.
Could you please share more examples of how a deep understanding of pharmacology can actually make a difference in, or actually made a difference in your own translation or localization projects?
Yeah, okay. I'll give a couple of examples. One of them was kind of totally unexpected. I was translating an instruction for use for a medical device, and it mentioned a drug product which is very widely used, which is paracetamol or acetaminophen. And as far as I remember, the instruction for use mentioned acetaminophen. And I realized that our target audience doesn't know this name, because it's in the target country, the drug is called paracetamol. So I suggested we change it for convenience. That's small, but I think it's really important. And another, there was a time when I worked on a patient-oriented document. I think it was for a clinical trial, and it explained pharmacokinetics, how the drug is absorbed, eliminated, metabolized. And there was a moment when it was my understanding of all these terms and processes helped make the translation understandable to patients, because we really had to transform the wording in the target language to make this understandable, so that the patient would also understand what they're talking about. I think it's just how deep understanding of the topic helps translators convey the message to lay audiences. It's really important. That's why in my course, I also make sure that my students, first of all, they understand all these basic concepts, and they have this kind, they finish the course with a structure in their head, so that that's the main thing, because they can add details later by studying the additional materials I provide and watching some videos and so on. But they have a system to expand their knowledge.
Mm-hmm. Back to your to your first example. The funny thing is, paracetamol is so popular, or the term for paracetamol is so popular and used in Italian. We actually have a song called Paracetamolo. Yeah, that's true, and it wouldn't work with the other word, which I don't remember, but there's no song for that, so yeah, we didn't know about that.
Yeah, that's an important thing there. The other word was acetaminophen. It's an American name. They have different names for some drug products, so it's a thing to remember when you translate pharmaceutical texts.
And are there some cultural and linguistic nuances that translators and interpreters must consider when working with pharmaceutical content? You said in different languages and regions other than paracetamol?
Yes, sure. Of course, there are. Yeah, and it's well. There's a nuance again because of all the regulations. These nuances might be cultural, and they also might be country specific. Related to the regulations. As for the cultural nuances, mostly they consider administration of the products and patient-oriented, patient-facing materials. Some aspects of drug administration you might want to look for language that patients will understand. For example, in English texts, some Latin expression can come up, like oral administration, or it might be easy to translate it with a similar Latin-based equivalent, but it might not be understood by patients. I've even conducted some service on my Facebook page back many years ago to get an understanding of how my friends who are not doctors and pharmacists do they understand some terms related to drug administration or not. There's also a standard wording in patient information leaflets. These are the paper sheets that come with a drug product in a package, a patient information leaflet. And they might suggest that patient contacts their pharmacist or doctor or someone, some healthcare professional, if they have any questions. And you might want to localize it according to the culture or country whom patient can actually contact and how this person would be called. For example, I studied pharmacy, and my degree is called provisor. It's a higher pharmaceutical education, but people don't understand this. My friends don't understand this. It's easier to call me a pharmacist, which would be lower level of education, but people understand who this person is. And during translation of this patient-facing materials, it's also important to keep in mind who is communicating with the patient and whom the patient will come to clarify something. And there is also this nuances related to the market and country, because for example, when creating promotional materials for patients, we always think about the patients, but we also think about the authorities and regulations. And as a medical writer, I also have now a much deeper understanding of why this is all important and how strictly it's regulated. So you have to use specific wording to, for example, the disease that the drug treats should be called exactly how it is called in the approved information for use. And this is called therapeutic indications, and they are approved and should be followed strictly. So also There is a classification called Anatomic Therapeutic Chemical Classification of Drug Products, ATC. It's very widely used internationally, and there are official translations of this classification. So if the patient information leaflet or the prescribing information, if it references ATC, the translation should go and look for the approved name of the class rather than invent it using a dictionary. And there are many others nuances related to this as well that are region specific and country specific. And this market specific regulations affect the language because it might be also tied to advertising and how you can formulate how you can phrase some of the claims related to the products and so on. Okay.
Mhm.
I think
That's about it.
yeah, I think there's also a fun fact that I put aside for this interview. I've come across a notion that in one study only about 30% of patients were able to fully understand patient information leaflet written in their language by specialists. So that's a thing to keep in mind when you write documents about patients. This is where these cultural nuances really matter. The level of education and understanding and the words you use, they can really play a huge role.
Mm-hmm. So this is my very last question. So you have an upcoming course which is called Pharmacology for Translators and Interpreters. What can a participant expect to learn, and how will it benefit their medical translation careers?
Yeah, sure. I think the most amazing thing about this course is that it is tailored for translators and interpreters, meaning that we will be speaking about how drug products work, how drug substances work, but we will also always keep in mind all these official sources of information, and we will also cover different dosage forms and how the product is supplied and names of these dosage forms, which can also be officially approved somewhere or you might find them in some official classification or a guide or something. Sorry. So we will have a detailed introduction into these basic terms and concepts, which can be very helpful for beginner translators and which can also help experienced translators kind of structure their knowledge and maybe identify some gaps and areas for improvement. Then we will go through all the processes of drug absorption, distribution, metabolism, and excretion, which is pharmacokinetics. We will take a look at processes that take place in different organs in the human body in relation to drug molecules. We will take a look at how metabolism is performed by enzymes in liver and other organs. We will also consider then, of course, the pharmacological effects, the beneficial effects, and toxicity. We will touch, I think, a little bit it's important to keep in mind that this is tightly related to clinical trials and pharmacovigilance. So I want this course to be very practical, and for students to get additional value, I provide additional references and I explain some concepts, not only in theory, like in student books, but also in relation to clinical studies and preclinical studies and drug approval process. And at the end, we will also have a webinar specifically dedicated to prescribing information. We will take a look at the main documents for doctors and patients that are approved in European Union and other countries, and we will go through some nuances of translation of the documents that are called Summary of Product Characteristics and Patient Information Leaflet. So it's a very comprehensive course, and it helps build a foundation and also go make an inventory of your current knowledge, and helps build a plan for continued education as well, because there's no limit, in medicine and in pharmacology, pharmaceuticals, it's an always ever expanding and developing area, and this course will help grow and develop. So one last thing, also, as I mentioned, this course will help. This course provides all the important references that should be at hand during translation, that will help students in their work, that will help justify their choice and look for the right terms and classifications and so on. It will make the work much easier than when you just Google something and have to double check every source.
Okay, that looks great. So thank you so much, Ekaterina, for your time and your precious advice today. And you guys, if you want to learn more from Ekaterina, please consider attending her course, Pharmacology for Translators and Interpreters. So thanks, everyone. Thanks again, Ekaterina, for your time, and see you very soon.
Okay, thank you. It was nice talking to you. Thank you for coming. Bye.
My pleasure. Bye-bye.